If we could show the view of the subclavian dissection.
I'm Newell Robinson, Chairman of Cardiothoracic and Vascular Surgery at St. Francis Hospital. During the height of pandemic, there was a tremendous amount of fear associated with being around other patients with COVID-19. We had a very structured approach to the treatment and the triage and the management of patients. Our focus was related to the life-saving efforts of large numbers of people infected with this virus, and unfortunately, the consequence of that is that patients, if you want to refer to them any other way, everyday patients with everyday problems, were left out of the picture in many cases, simply because of the overwhelming nature of the problem. So it's understandable that there's fear associated with coming back into the healthcare facilities. What I can say to patients now is what I would say to my family and what I would do for myself, and that is to say that the hospital, St. Francis Hospital, is perhaps one of the safest places you can be now. Our population of COVID patients is very low, practically negligible. All of the methods that we have used to isolate and treat patients has worked. We have had no evidence that there's any significant cross-contamination or infection related to coming in back into the facility. But more importantly, these problems, these everyday problems that you suffer from as a patient, cannot take the back burner anymore, that you need to come to the hospital and you need to be treated. We have the capacity to take care of patients now, and I would say that our volume of surgeries and volumes of patient visits is back up to around 85–90% of what it was pre-COVID, and that the ability to test, to manage and properly treat patients with cardiovascular disease is the most important aspect, and point to get across to the patient is that you can come back now, it's safe, and in fact you should come back to be cared for before something happens with respect to your health.